Hello, everyone. Welcome to my career presentations. Today, I want to talk about anesthesia technicians. So, who are anesthesia technicians and what do they do? So, anesthesia technicians is one of the professions um, amongst the allied health professionals. They are the ones that working under the guidance of anesthesiologists, which their job is to sedate patients in numbing pains and relieving pains during and post during and post surgery. In terms of settings, most anesthesia technicians work in the surgical unit, specifically in the OR, which is the operating rooms. Some of them might also work in other clinics environments alongside with anesthesiologists, such as in dentists, in dental clinics and all that. Um, in terms of responsibility, there are many responsibility that an anesthesia technician has to um, perform. Uh, First, I want to talk about that they are the ones that preparing and maintaining surgical equipment before the surgery. They're the ones that preparing the surgical rooms for the team and also preparing the equipment and also the ones that are bringing the anesthesia drugs under the guidance of an anesthesiologist. Um, During the procedure or the surgical procedure, they working alongside with anesthesia nurse to monitor patients' vitals during surgery to see if there are anything that is questionable in their vitals and report it back to the anesthesiologist and to the surgical teams. They're also operating other anesthesia equipment alongside with doctors and nurses. And it is a very high stress job. They're working in a very high stress environment because it is in the surgical rooms and life and death decisions are making can be made within you know minutes or seconds. Um, let's go to educations and experience. In order to become an anesthesia technician, you don't really have to get a lot of prereqs. Um, just a high school diploma, and that will be enough. But you need to get certified by the American Society of Anesthesia Technologists and Technicians, um, short for ASATT. You have to pass their board exam and have at least 2 years of clinical experience and an associate degree um, as an anesthesia technician that covers basically written, verbal, communication skills, math, science courses such as medical terminologies, human anatomy, and human physiology, and that it's within the associate degree for the for anesthesia technicians. Um, if you want to know more about the board exam, what to expect for the board exam, and how to prepare for it, you can visit www.asatt.org. They are the ones that giving out tests and certified anesthesia technicians. In terms of competencies and expectations, an anesthesia technician holds a lot of you know area of responsibility. I want to talk about assessment and planning first. You have to be able to assess your work and assess a patient's situations and how to basically providing the patients the best care because every patients are unique and are different and you have to adjust um, to that. They also have to be able to plan ahead of time because they are the one that providing surgical equipment for the surgical teams and basically preparing the surgical room along with other staffs for the surgical team as well. In terms of evaluations during the surgical procedures, there can be many things that happens, um, even like regardless of um, if it's life or death decisions or what. But you have to be able to evaluate every situation, report it back to the doctors, and able to communicate with the team. And that is also the next area of responsibility. So responsibility, which is communications. working with the surgical teams, you have to be able to communicate not only from yourself as an anesthesia technicians, but also receiving messages and communications from the entire team to adjust your task appropriately. Anesthesia technicians, as I mentioned, also providing care for the patient post-surgery. So they have to maintain proper ethics and professionalism um, within their jobs in order to talk to the patients and get respect for the patients. Um, if you want to become an anesthesia technician, there are many expectations. You have to be able to work under a high stress environment. You have to be very detail oriented because the job is such a crucial part in the surgical teams, and every moment has to be basically uh, every moment can be a life or death decisions. And even though you're working under that stress-filled environment, you have to be able to maintain calm and professional manners. In terms of employment lookout and career path, um, anesthesia technicians and other allied health professionals, um, there are it is a growing field and with very high demand, according to the U.S. Bureau of Labor and Statistics. Surgical technology related jobs such as anesthesia technicians or anesthesia technologists will grow by about 15% by 2024. One thing that I forgot to mention and put in this PowerPoint is that an average um, an average eh, salary for an anesthesia technician per year is about starting off is about $40,000 a year, which is not much for a starting job. But if you look at the requirements for anesthesia technicians and the training, um, it is actually it's actually a very good deal um, with a 2 years degree. Um, in terms of career path and advancements, I would say there are many paths you can go with this job. You can become an anesthesiologist, um, or if you want you can become an CRNA, which is a certified registered nurse anesthesiologist. Um, but one thing that I recommend is that you can become an anesthesia technologist, which is very close to anesthesia technician. It is a bachelor degree, a 4-year degree with 2 semesters of clinical training, and that will be for the career path. The question is, why did I choose this job to present to you guys? Because I have spent over a year working as a health scholar in St. Joseph Hospital. I spent probably 100 to 150 hours in the OR already, working with the surgical teams um, to be able to assist with direct patient care alongside with nurses and other staffs. And I aspired to to become a part of the surgical teams and specifically to become an anesthesia technician because they are the foundations for the surgical teams. Um, when I look at it, they are the ones providing all the equipment, cleaning the equipment, providing basically the surgical room for the teams. They're also monitoring patients' vitals and even post-surgery, they the one that transferring the patients and doing all of the pain relieving sessions under the guidance of anesthesiologists. So I think it's very cool um, as a job because there are such a diversity in terms of responsibility that you can do. You can work in the OR, you can work even in clinic settings, such as dental offices and all that. So yeah, that's the reason why I chose to become an anesthesia technician. I hope you guys like my presentations, and I hope you guys can think about, know more about um, anesthesia technicians as a whole. Thank you guys. And here are my references.